Hey guys, Tony Maritato here. So I just wrapped up Module 5 of Zero to Paid Medicare Billing. That's the course that I teach that helps clinicians understand how to work with Medicare and non-Medicare plans. So in Module 5, we cover Medicare Advantage and non-Medicare billing out of network. And so one of the topics that came up tonight that I think is worth sharing publicly is the idea around understanding, once you know how to bill out of network, what you can do, what you can't do, terminology, like understanding what it means to accept assignment or not accept assignment, what it means when you talk about balance billing, prompt pay discounts, all of this stuff that we need to know, stuff that I wish we would have learned in PT school, but we didn't. Now that clinicians are starting to understand this, the next level of this game is to understand how and when we apply this information. So as a classic example, if you are choosing to be an out-of-network provider, once a patient, a non-Medicare patient, commercial insurance, meets their out-of-pocket max, if their plan has out-of-network coverage, it literally makes no difference to the patient whether the patient sees an out-of-network provider or an in-network provider. Prior to meeting the patient's out-of-pocket max, it almost always costs the patient more money to see an out-of-network provider. But let's assume for a second the patient had surgery, or maybe some other traumatic event. Maybe the individual had a stroke. Maybe they had some brain injury that was going on. They had an ICU admission. Maybe they had some skilled care. They had other things that were driving up the cost of their services. And as a result, they satisfied the plan's out-of-pocket max for the year. Now that plan has out-of-network coverage in this situation. Your best interest is to open the door for that individual to be able to receive services with you, because I know if you're watching the videos on this channel, you deliver a higher level of service than pretty much any of the larger corporate clinics. It's just by necessity, as a small private practice provider, I know you probably have better services. So that being said, you would want to develop a marketing campaign dedicated to attracting and informing those clients. Right? So if we're in a neuro-based outpatient clinic and we want to attract clients who have had a stroke, who are returning to independent living, but maybe they've had an extensive amount of medical services already, they've met their out-of-pocket max, your marketing effort, your marketing communication should focus on that individual. You can focus by insurance. You could be the specialist in outpatient neuro rehab for, adults in your city, your state, who have had a stroke in the last 3 months or 6 months or 12 months or however long you want to go. You're probably more likely to find individuals who have met their out-of-pocket max, who have also had extensive orthopedic surgeries, like a total knee replacement, like a rotator cuff repair. I would not be marketing to young, highly active individuals. So in other words, somebody who is 27 playing a recreational basketball league, sprains an ankle on a Tuesday night, no past medical history, no surgical intervention, they're probably not going to meet their out-of-pocket max for their insurance provided through their employer. But an individual in their 50s or 60s who has had a major event, they probably would meet their out-of-pocket max. And if you're looking at ramping up the marketing for this kind of situation in March, April, May, all the way through the latter part of the year, again, you have a better chance that these are individuals who have met their out-of-pocket max. So when somebody comes to you with the question, do you take my insurance? The answer should always be yes. And then the follow-up question is, let me collect your information. Let me verify your coverage. I'll call you back before we do your initial evaluation to let you know exactly what the cost will be. And that's what gives you the time, that's what gives you the resources to really put the best plan together for the patient. And if you find out that, the patient hasn't met their out-of-pocket max, they have a high deductible plan, you can provide them with alternative solutions. If you go to an in-network provider, you'll do this. If you choose to come to me, you'll do this. And you give them the right to choose what it is that they do. So guys, there's always a strategy. There's always a method to the madness. Don't just take the information that you've always heard, that people have always said. Learn and research and come to your own conclusions. I hope these videos help you. If you want to see the next video that YouTube recommends you watch, go ahead and click on that thumbnail right over there. If you haven't already subscribed to the channel, please do, and I will catch you guys on the next video.